Awesome. Hi, and welcome to our final webinar of the Mental Health and Construction series in partnership with the Maryland Center for Construction, Education, and Innovation, and of course, the National Alliance on Mental Illness in Baltimore. We've loved this partnership and we're eager to build a better workforce by engaging in mental wellness across the industry. I would first like to introduce Julie Funk of NAMI Metro Baltimore and her team to discuss depression and suicidal ideation. Take it away, Julie.
Thank you so much, Emma. As Emma said, my name is Julie Funk. I am the Development Director at NAMI Metropolitan Baltimore. We are the nation's largest grassroots mental health organization. We're dedicated to improving lives and providing support and resources for people living with mental health conditions and for their loved ones. We're excited to be here today for another installment of our mental health series with all of you, our final installment of our series with you. We will be talking about sensitive topics surrounding suicide and depression. Today you'll hear from two of our incredible volunteers at NAMI Metro who will share their personal mental health journeys with you. Before I introduce them to you and we hear from them, I'd really like for us to talk through some of the facts and statistics around suicide in our country. If you have any questions along the way, please feel free to use the chat feature to get them to us, and we're happy to answer things. We can answer them as we go, or there will also be a time for question and answers at the conclusion of the stories from Shannon and Ryan. So, knowing the numbers, thoughts of suicide can be frightening, but by reaching out for help or checking in with family and friends, we can avoid devastating outcomes. Suicide is the second leading cause of death among people aged 10 to 14, and the third leading cause of death among those aged 15 to 24 in the US. It's the 12th leading cause of death overall in the United States. And it's important to note that 46% of people who die by suicide have a diagnosed mental health condition. That said, 90% of people who die by suicide may have experienced symptoms of a mental health condition. And that's according to interviews with family, friends, and medical professionals after the death. It's known as a psychological autopsy. Here's some statistics surrounding different age groups. This is the annual prevalence of serious thoughts of suicide by demographic group. So 4.9% of all adults have serious thoughts of suicide. 11.3% of young adults aged 18 to 25. Nearly 19% of all high school students, and 45% of LGBTQ youth. We have high-risk populations. Lesbian, gay, and bisexual youth are nearly 4 times more likely to attempt suicide than straight youth. 79% of people who die by suicide are male, and transgender adults are nearly 9 times more likely to attempt suicide at some point in their lifetime compared to the general population. So those are some pretty devastating statistics. I think, especially when we're looking at these numbers here about suicidal ideation and the percentage of populations that are experiencing suicidal ideation, I think it's really important that we continue to have these conversations about suicide and about depression. I do want to talk about some of the warning signs. So there are a few warning signs of suicide. A lot of people see increased alcohol and drug use. Aggressive behavior is a warning sign. Withdrawing from friends, family, and the community is a warning sign. You can see dramatic mood swings or impulsive or reckless behavior as well. Suicidal behaviors are a psychiatric emergency. If you or a loved one starts to take any of these steps, you should seek immediate help from a healthcare provider or call 988 to reach the Suicide and Crisis Lifeline. And those steps that, if you see any of these, are what NAMI National recommends you reaching out to someone for support. Collecting and saving pills or buying a weapon. Giving away possessions. We oftentimes hear about people giving away their possessions before attempting suicide. Anyone who you see tying up loose ends, like organizing personal papers or paying off debts, or anyone who is systematically saying goodbye to friends and family. Those are the primary warning signs of someone who is experiencing suicidal ideation. Risk factors. We did talk about how 46% of people who die by suicide have a known mental health condition, but there are several other factors that may put a person at serious risk of suicide, and they include, but are not limited to, some of the following things. A family history of suicide increases a person's risk. Substance use. Drugs can create mental highs and lows that worsen suicidal thoughts. Intoxication. Analysis from the Center for Disease Control indicate that 1 in 5 people who die by suicide have alcohol in their system at the time of death. Access to firearms is a risk factor. A serious chronic medical illness is a risk factor. And gender. Although more women than men attempt suicide, men are 4 times more likely to die by suicide than women. A history of trauma or abuse, prolonged stress, or recent tragedy or loss are some of the most well-known risk factors surrounding suicidal ideation and suicide. So supporting someone in a crisis. When a suicide-related crisis occurs, friends and family are often caught off guard, they're unprepared, they're unsure what to do. We don't have enough of these conversations where we share some of those things. The behaviors of a person experiencing a crisis can be unpredictable or change dramatically without warning. So there are a few ways to approach a suicide-related crisis. And this first one I'm going to say, I think, is so incredibly important. And it is the opposite of what I thought to be true when I first learned these ways to support in a crisis. And that is that you speak openly and honestly. You should not be afraid to ask questions like, do you have a plan for how you will kill yourself? You need to be able to ask a person if they feel like they might commit suicide. You need to not be afraid to say those words. You need to be able to directly ask about the problem, directly ask about suicide, and not ask sort of neighboring questions or try to get a feel for. The number one thing that we've learned in these conversations through behavioral health experts is you need to directly ask, do you have a plan for how you would kill yourself? Other ways to support: remove any means. Remove guns, remove knives, look for stockpiled pills, remove stockpiled pills. Calmly ask simple and direct questions like, can I help you call your psychiatrist? If there are multiple people around, have one person speak at a time. Express support and express concern. Don't argue, don't threaten, and don't raise your voice. Don't debate whether suicide is right or wrong. If you're nervous, try not to fidget and pace. Be patient. If your friend or family member struggles with suicidal ideation day to day, let them know that they can talk with you about what they're going through. Make sure that you adopt an open and compassionate mindset when they're talking. Instead of arguing or trying to disprove any statements that they make, like, your life isn't that bad, Try instead to actively listen, reflect their feelings, and summarize their thoughts while they're speaking. This can help your loved one feel heard and validated. Also important, let them know that mental health professionals are trained to help people understand their feelings and improve mental wellness and resiliency. Psychotherapy, like cognitive behavioral therapy, can help a person with thoughts of suicide recognize the ineffective patterns of thinking that they are experiencing. Validate their feelings and learn positive coping skills. Suicidal thoughts are a symptom of a larger issue. Just like any other, they can be treated and they can improve over time. I want to pause here to see if anyone has any questions about those statistics, anything they want to share about how to support in a crisis before we move into our conversation today where we hear from our volunteers.
Hi, I had a question about attempted suicides, and maybe you'll cover this, but I'm just curious at how many the stats that you read off in the beginning about suicides, how many of those had previously attempted suicide? Do you know that number?
That's a great question. I don't know the answer. It looks like Shannon might. So Shannon, you're on mute, but I'm happy to get that information for you. You're still on mute, Shannon.
Okay.
There
There
you
were
are.
almost 46,000 deaths by suicide in 2020. For every death by suicide, there are 25 suicide attempts. And there were almost 1,150,000 suicide attempts in 2020. 90% of people who have attempted suicide do not die by suicide. But a previous attempt for suicide, a previous attempt of suicide is a risk factor. But 90% of people who attempt suicide do not die by suicide. So that is the short answer.
Okay, thank you.
Thank you, Shannon. Any other questions? There will be time for questions later as well. If you think of anything along the way about statistics or anything like that, if you have any questions or follow-up questions, I will say that for those of you who haven't joined us before, the National Alliance on Mental Illness is not made up of behavioral health experts. We provide support and resources for people that are meant to work with any behavioral health support a person is receiving. But that is not to say, so I am not a clinician, but I can get information and share it with Emma, and I'm sure she would gladly pass it along to you. So if there is additional information that you would like to know, we will reach out and get that right information, the correct information for you. So without any more delay, I really want to turn this over to the real reason why we're here, and it's to meet Shannon and Ryan, who are going to share their personal mental health journeys with us. I'll let them tell you a little bit about themselves because it will be woven into their stories as well. But I just want to say that it is incredible that we have these volunteers who so openly and vulnerably will share their story with all of us. And so Shannon and Ryan, thank you in advance for being here today and for joining all of us for this discussion. We will start out with Shannon sharing her story. So I will stop talking, Shannon, and let you take the floor.
Thank you, Julie. Thank you for asking me to talk today about how I recovered after 30 years of depression and attempting suicide. I have been a NAMI in our own voice speaker since January of 2019. So I will share using that format with an introduction, what happened, what helped, and what is next for me. I'm the proud mother of 2 children in college. Throughout my life, I've surrounded myself with children's books. I read picture books with young children, and in my spare time, listen to audiobooks of middle grade fiction. I enjoy swimming and walking. I am also active in my faith community, Silver Spring United Methodist Church, a congregation where all are welcome, and I have been a member since 2008. I realize I am incredibly fortunate to have such a supportive faith community, and am aware that some with mental illnesses have been hurt by some faith communities. I hope that by sharing my story, more places of worship will be supportive and caring. In addition to my experience as an in-our-own voice speaker, I have co-facilitated more than 70 virtual NAMI Connection recovery support groups in the last year. USA Today published my essay, Discovering a Lens of Hope, in April of 2020. Reverend Michelle Johns from Silver Spring United Methodist Church and I co-presented on how faith communities can welcome and support suicide attempt survivors at the Maryland Suicide Prevention Conference in 2021. My essay, Learning to Hope After 30 Years of Depression and a Suicide Attempt, was the first guest post on Speaking of Suicide, an internationally known suicide prevention website. I'm training to become a certified peer support specialist in Maryland through NAMI and On Our Own Frederick County. I had some challenges in my childhood, as most people do. Both my natural parents were married 3 times and each struggled with major depression. I am the only child of the middle marriages. I moved schools, cities, and sometimes countries and parents every year from 4th through 12th grade. I also know I was privileged as a white youngster and never was without shelter or food. When I was 17 in 1984, I accidentally fell 25 feet while hiking in the Rockies. Some amazing friends ran down the mountain and called Flight for Life. Other friends sat with me on the mountainside until the helicopter arrived to fly me to a Boulder hospital. I suffered a traumatic brain injury and was comatose for about 4 days. I have no memory of my hiking fall or the first 2 weeks afterwards. I delayed entering college a year, but eventually completed both college and graduate school. I married in 1996. I worked first at a nonprofit and then teaching high school at private schools. But each job turned out to be too difficult for me, given my deficits due to my brain injury. My 2 wonderful children were born in 2001 and 2004, yet the long-term effects of my brain injury persisted, including confusion, depression, and fatigue. In an attempt to compensate for my deficits, I controlled what I could by over-exercising and limiting my eating. I was diagnosed with anorexia in college, and those habits followed me for 30 years. Although I never drank alcohol or took drugs, undereating and overexercising was my addiction. I neglected basic household chores and my physical health. In 2010, my marriage ended. After a couple of years, I was able to get on Social Security disability, but still had severe depression. In 2015, my mental illness caused me to attempt suicide by jumping in front of a metro train. Rescuers and doctors were able to save my life. I suffered multiple broken bones and another injury to my brain. Doctors had to amputate the front portion of both my feet. I had no memory of my suicide attempt or the first 6 weeks afterwards. I spent 6 months hospitalized, including 4 months on the behavioral health unit, where doctors found the right combination of antidepressants that worked best for me, and I learned to walk again on my partial remaining feet. After my hospital stay, I moved into the first of several assisted living facilities where I resided for 5 years. At a local medical clinic, I began electroconvulsive therapy, which I continued for more than a year. At each session, electrodes were taped to my forehead. I received an anesthesia, so I was sedated while my brain was electrically stimulated. Nurses held my hands as they placed the IV and stood beside me with smiling faces when I woke up at the end of each session. I did present a challenge to them, as the usual way to determine responsiveness under a sedative is monitoring the toes. This was not possible in my case, as I have only partial feet, but those nurses adapted and never lost their ability to smile, encouraging me to do the same. While I was still in the hospital, one of my friends called the helpline of NAMI and learned about a group of therapists who drive clients where they need to go to progress. I connected with Debbie, who has 40 years of experience in recreational therapy. Through her, I learned that recreational therapy enables people to recover through activities they enjoy. Since I was not allowed to leave the assisted living facility alone, I told Debbie I wanted to go on walks outside during our time together. Debbie encouraged me to return to activities I had enjoyed when I was younger, such as sharing children's books. With her encouragement, I enrolled in the training class offered through the Literacy Council to teach adults how to read. For more than a year, I met weekly with the Egyptian woman, teaching her how to read picture books that she then read with her grandchildren. When I told Debbie that I had swum competitively in high school and college, she took me to the local pool. I was not afraid of the water since I'd spent so much time in pools during my younger years, but I was concerned about what people would say when they saw my partial feet. I still remember Debbie's hand on my back as she steered me into the pool locker room the first time since my suicide attempt. I was met with the familiar smell of chlorine and began to relax. After a few times at the pool, I soon realized people rarely mention my feet. They may have stared, but given that my eyesight is poor without my glasses, I did not notice. I was just happy to be in a swimming pool where my feet mattered little. In April of 2018, my psychiatrist told me that my depression was in full remission. He also told me thought I was ready to ride the metro again, but he wanted me to ride with Debbie at first. I recall that first ride when, by coincidence, Debbie and I both wore orange t-shirts. When we reached the train platform, I looked at Debbie's face, not at the tracks, as the train pulled into the station. Debbie took my hand and we boarded the train. We'd agreed we would ride only one stop before turning around and returning. We found a seat close to the door because my partial feet didn't give me the balance to stand on a moving train. At the next station, my confidence rocketed when the door opened. As we stepped off the train, I reached my hand back for Debbie. She said, "Let me just switch my bag to the other shoulder so I don't trip you." I joked with her by saying, "Yeah, that would not be something you want to put on your resume." As we laughed, standing on the platform, I saw a white bird with outstretched wings sailing across the blue sky. I still focused on Debbie's face as I heard the train approach the station, but this time I didn't have to fight the urge to cover my ears. Debbie and I rode the metro together every week for the next month. On our third time together, as we stood on the platform, I told her about the phone conversation I had had the previous night with my daughter that it ended when I said to my daughter, "I love you very much." My daughter had replied, "I love you very much too, Mom." As I told Debbie about that conversation, I saw a mother bidding goodbye to her own daughter, a toddler in a stroller, by making a heart shape with her fingers. By focusing on the paired images of the heart-shaped fingers and the echoes of my own daughter's words, "I love you very much too, Mom," I was able to watch the train arrive at the station with a smile on my face, something I had previously never dreamed possible. By using that same imagery on our next trip, I found I could watch the train arrive at the station without fear. 2 weeks later, in May of 2018, my psychiatrist gave his full approval for me to ride the metro independently. A woman from Silver Spring United Methodist Church, whom I will call Olivia, happened to be on the train I jumped in front of that Sunday morning in 2015. She went to church and prayed for the person who had been struck without knowing it was me. Reverend Michelle Johns led the prayers that morning. 3 years later, when I was given approval to ride the metro independently, I happily shared the news at church while sitting with Olivia and other friends. 2 months after I had begun riding the metro independently, I learned Olivia would be leading a group from our church to go to a baseball game. The group would be riding together on the metro. I wanted to go, but I was worried my presence on the train would cause other church members to be uncomfortable. Very tentatively, I asked Olivia if I could join the group. Without a moment's hesitation, she said, "Definitely, I've got your back, always have, always will." With those words and a successful trip to the ball game, I knew I never had and never would walk alone. In January of 2019, I completed the training to become an inner own voice speaker. I found a sense of purpose and meaning. Hearing the story of others enabled me to focus through a lens of hope. When the pandemic began in early 2020, I still resided in assisted living. My life was confined to a small bedroom, a tiny kitchen area, and a bathroom. I was more anxious than ever to move and live independently in my own apartment, but my psychiatrist had to approve the plan. I needed to prove I could remain positive, even in these difficult circumstances. I began keeping a daily gratitude log that I learned about through the support groups and the volunteer work I did with NAMI. In the gratitude log, I kept track of every phone call and online interaction I had with my church, friends, and church members. I even wrote down the joy I found from seeing a bird flying with outstretched wings out my window. When I face challenges, the gratitude log enables me to reflect on what I've learned from difficulties. During the early months of the pandemic, Reverend Michelle called me every week. In one phone conversation, as I described my journal in detail, Reverend Michelle appeared unusually quiet. I asked her why. She replied she didn't want to interrupt me. I told her, please don't worry about interrupting. You of all people should know there's no way you can step on my toes. We laughed together. This conversation was one of many examples of caring people who showed support to me by helping me to find humor in my situation. In October of 2020, I moved out of assisted living, but I've continued keeping the gratitude log for more than 850 days. On Easter Sunday, 2022, our church's first in-person Easter service since 2019, Reverend Michelle announced from the pulpit as I sat between Olivia and another church friend I've known for more than a decade, that I had won a national award for sharing my mental health recovery story. The end of April, I made my first independent plane flight in 12 years to receive the Transforming Lived Experience Award from the American Association of Suicidology, the oldest suicide prevention organization in the nation, at their conference in Chicago. And yes, I did go through the airport security scan wearing socks on my partial feet. As I received that award, I said, I spent decades never knowing anyone could get over suicidal ideation or recover after a suicide attempt. I know many of you have your own mental health recovery stories. We need you to talk and write about your recovery. Each and every story matters. I found my lens of hope and grace, and you know you can as well. Resilience is built through community. Your story is important. Believe in it and shout it out. Thank you. And it's yours, Ryan. You can take over, Ryan.
Thank you very much, Shannon. I wish there was a time where I could actually pinpoint that this was the moment where I was diagnosed with my mental illness, or this was the moment when I first started having symptoms. But it's not always the case with people who typically deal with a mental health condition. My story starts back as a kid. I lived with a mother who was addicted to drugs. I was dealing with abuse from my mother. And then when I was taken away by Child Protective Services and returned back to her, I was put out of the house. I eventually ended up staying with a teacher who ended up sexually abusing me for the next 5 years afterwards. And it was during that time where I first started self-harming. I didn't know anything about dealing with depression. I just knew that I was in a situation that I didn't want to be in. And at the first chance I got, I left home, I left Texas, I moved to Washington, D.C. My mother, for all of her flaws, it wasn't necessarily her fault. She dealt with a mental health condition and we were never told or explained what it is. she deals with schizophrenia and dissociative identity disorder. There are times where she would try to climb the walls. There were times that she would be talking to someone that we couldn't see. She would hear things that we couldn't hear. And all the while, we were just kids, my brothers and I, and we knew nothing. You know, everybody has, you know, that crazy uncle, as they call them, or the guy that walks down the street with the headphones that people just say, just leave him alone. He's not harmful, just leave him alone. He's trying to drown out the sounds of the voices that he hears. And with my mother, she did drugs because she was trying to get the voices and everything that she was hearing and the hallucinations that she was seeing up under control. And I remember those things as a child, but I didn't know how they would apply to me as I would go on moving forward through college and eventually life. There are times where, you know, I was in college, I thought, hey, I'm no longer back in Texas. I don't have to deal with this anymore. I'm good, I'm safe. And it was during that time where depression really started to hit me. After a couple of years in college, my grandmother passed away and I just completely fell in depression, ended up leaving school. There was a point in time where I was homeless. I had friends I was staying with in their dorms. There was time I was staying in my professor's offices at school. I was staying at the bottom of the chapel. I didn't really understand what was going on with me. And I really wish I could say that, hey, I went and got help right then and there. But that wasn't the case. You don't really know how to get help if nobody ever taught you how to get help. And so a lot of times it was just me just trying to figure out what's going on with me on my own without really having somebody to hold my hand or to guide me. It would take 7 years after I would leave college, after I dropped out of college, to really start looking at what's going on. I started with myself and I was just like, okay, I know that I'm dealing with something. Let me at least go to therapy. Maybe I have some trauma that I need to deal with. And indeed, I couldn't afford therapy because health insurance at that time was not going to pay for it. And so I ended up going to Georgetown University where they have the residents there, and I did therapy on a pay scale. From there, I started trying to get help otherwise. I started with NAMI because I really wanted to understand my mother. So I took a family-to-family class. And while I'm in that class, I'm sitting up here listening to everything that everybody is saying and everything that's in this book, this binder that we have. And I start to realize that a lot of this stuff applies to me. And so I was like, okay, what do? I didn't have the money to get the help that I really wanted or needed at the time. So I signed up for a clinical trial study, the next best thing, because at the end of the study, they would help treat my illness because I did qualify for depression. And I remember during this study, and it was just the weirdest thing to me, we were given MAO inhibitors. It was a double-blind study. I don't know if I was getting the medicine or whether I was getting a placebo, but it was these giant pills and it was 25 of them I had to take a day. That will probably drive you crazy just by itself. But the thing that bothered me the most was that I couldn't eat chocolate. That's the thing that I just couldn't deal with, because it's like, I want chocolate. I can't eat chocolate. I can't eat cheese with the MAO inhibitors. Is they give you all this information about the medicine just in case, so you don't mess up the effects of the medication. And it was maybe 3/4 of the way through of dealing with the family-to-family class, I finally just had my first mental break. Out of all the suicide attempts I had attempted in the previous decade, this was the one where I just cut everybody off and I was determined to end it. It was a friend, a very close friend of mine, that made it out to me and sat down and talked to me. By this time, I had cut up my arms pretty bad. I just really wanted out because the hurt of dealing with what I was feeling was just so much. And so I agreed to check myself into the hospital. And when I checked myself into the hospital, a lot of things started making sense. I was diagnosed with borderline personality disorder. which is one of the major mood disorders that are out there. And I was given a cocktail of medications that I really didn't understand, but I just knew that after taking those medications, I didn't really feel myself anymore. I was lethargic all the time. I would wake up in the morning and it would take me another 4 or 5 hours just to even be awake. I spent my whole life, my whole adult life, as a software engineer. And I have been in the software engineering field for 24 years now. And it was rough. When you really need the full capacity of your brain, you really need to be alert. I didn't have that ability. And it was after that where I had to start having talks with my therapist and talks with my psychiatrist about, I can't do this. It's just too much for me. The medication is pretty much turning me into a vegetable and I couldn't make my living the way that I wanted to. After I was pretty much weaned from the medication, I continued with my therapy for a number of years. And I wish that was the end of my story. You know, everybody has a light at the end of the tunnel, and it just seemed like mine just kept getting darker. My wife and I, we decided to adopt 2 children. And shortly after that, she got pregnant with our first child. I ended up having to bury my child. And that's not something I would wish on anyone. And that sent me spiraling all over again. I ended up trying to deal with and trying to support my family as much as possible and trying to do everything as much as possible by myself until I finally just broke down and I ended up going to an intensive outpatient program. And I had to deal with grief. I had to deal with depression, and I had to deal with a new thing that I never had to deal with before, and that was anxiety. My anxiety was so severe that I just couldn't do anything. I couldn't work. I couldn't do school. I struggled. And that's when I had to start building a whole new set of coping skills. And after that, I was tested even more by having a daughter who was in the hospital for 9 months. I almost lost my wife and my daughter. My wife ended up hemorrhaging very badly. And I had a daughter that weighed 1 pound, 8 ounces. And then I had a son that was in the hospital for 4 months, who we thought was brain damage, but he turned out to be perfectly fine. I would say that there is no moment in time that you just stop dealing with your mental illness. There's no moment in time where you're just going to be completely cured of everything. It's basically ongoing maintenance from the time you're diagnosed all the way up until the time you pass away. But I can say one thing, that the person that I am now, I'm very appreciative of the person I am now. The work that I've been doing with NAMI, I love the work that I do with NAMI, and NAMI has been very instrumental in my success and even in my career. In 2019, Nancy Abraham, which a lot of you may not know by name, founder of NAMI, was given the Jefferson Award for Public Service, which is the most prestigious national recognition system honoring community and public service in America. 2 years after she was given the award, I won the Jefferson Award for my work with NAMI. And one of the things I would definitely say is that NAMI has always been a resource. NAMI has always been there in the community.
Is anyone else having
Thank you so
trouble?
much.
Yeah, I can't hear him anymore.
No, me either.
Ryan, I don't know, we lost you.
You're muted.
Doesn't
Can't
look
hear
like
you.
it doesn't look like your mute is on, but we lost you in the middle of that last couple
Okay.
of sentences.
Can
Oh,
you
there
hear me
you
now?
are.
There you
Yes.
go.
Sorry about that. I'm not sure where I left off at.
I
Um,
can tell you were telling us about receiving your award.
Right.
oh yeah.
That's great.
So, 2 years after Nancy Abraham received her award for being the founder of NAMI, I received the Jefferson Award for public service for my work with NAMI. I have been working with NAMI Northern Virginia for a number of years, NAMI Keystone. I just started with NAMI Baltimore. I've worked through NAMI MoCo, PG County, and even through DC. But this is something that I'm very passionate about that I intend to keep up, because this is not only something that helps others, but it's also therapy for me. And this is my story. This is not the end. This is only the beginning. And I hope that I was able to share something with you guys. Thank you.
Thank you both so much for sharing your stories with us. We are going to open up for questions now. So if anyone has any questions for Shannon or Ryan, or for both of them, I would love for you to go ahead and share those with us now, or put them in the chat. I can promise that they are open to questions and are trained to answer your questions, so please don't be shy. If there's something that you want to know, you can send it to the group, or you can direct message it to me or to Emma anonymously. We're happy to ask.
Hi, this is Henry, and I work in the construction industry. And I had a question. Well, first, thank you for your story. I really appreciate you sharing. I had a question regarding, how do you help people? How do you help, say, someone at a job site or at an office be more sensitive and aware of people with just different backgrounds, that they have no idea, like somebody could look at you and have no idea what you've been through, and this, sometimes the way we treat people, we will be the ones that trigger them to do something crazy, possibly because we just aren't sensitive. What type of training and information do you have to just help managers and folks that lead people to be aware and providing support for folks that, again, they have no idea of stories or backgrounds?
Thank you so much for that question, Henry. I can tell you that there are a lot of resources out there that I am happy to share with you. What we do at NAMI Metropolitan Baltimore is a program called Stigma Free Workplace. And so we do that we can either do it with the workplace as a whole, or we can do it with management, or whatever is desired by the person who brings us in. And it is really a presentation that talks about how to create a stigma-free environment, how to talk about mental health in the workplace, talks about the language that we use around people and how to be careful of the things that we say. We talk about how to best start a conversation about mental health should you have a concern about a coworker, if you or someone you manage, or if you are a person living with a mental health condition, how do you approach your manager to speak about that? And so we do that, again, with the voices of our volunteers with lived experience, so they can speak directly to their experience, but we do talk through some of those things. I think it's a good empathy building place to start if you're looking to bring this into your workspace.
Thank you.
Thanks.
Hi, this is Dave Hagan, and I'm a colleague of Henry's. And we've recently just started talking about suicide rates within the construction industry, and surprisingly, they're very high. And I'm wondering, how do we get from the point where we are reactive instead of proactive You know, it seems like, I don't know, I'm not speaking for Henry, but in my experience, we don't know that a person is in trouble until they've gone way off the rails. I suppose it's a matter of awareness, but I'm just trying to figure out how we get in front of it instead of just being reactive to it. Does that make sense?
Absolutely. Before I turn it over to Shannon and Ryan to talk about maybe what would have helped them in the workplace, I will say that 80% of people who live with a mental health condition in the workplace do not speak to anyone about it because they're afraid of the stigma surrounding it. And so anything that we can do to break down the stigma in the workplace, to let people know that you are open to having those conversations, that you have resources for anyone who's struggling. I think especially to let men know in a male-dominated industry that men are talking about mental health is really powerful. So when leadership steps up and says, this is something that we care about, the employee base is more apt to listen. And so I think it's bringing those stigma reduction presentations to the workplace, and doing that by putting people in front of them that look like them, that are from where they're from, that have been where they've been, and getting that conversation started. That said, Ryan, Shannon, is there anything in particular in the workplace that someone said to you that was helpful, or anything that you'd like to add to that question that Dave just asked?
Ryan?
Yes, yep. From my point, I think one of the strongest influencers to actually starting the story is to actually have people who's willing to share that story. I used to work for a very large consulting firm, and one of the things that I did through NAMI was actually present my story to my coworkers. And as nervous as I was at that time, considering that I saw my managers in the audience, there's people that was being broadcast to across the world, the thing that actually helped me after the fact was the people that came up to me and started sharing what they were dealing with, either by themselves or with their loved ones. And that meant a lot to me. And it made me realize that when it comes down to actually talking about mental health conditions, a lot of people just don't do it, but it's actually one of the most powerful things that you could possibly do. For men, we don't necessarily talk about our feelings. It's one of those things where it's like, if we're having a bad day, it's not like we're going to go to our coworker and be like, hey, I'm feeling depressed. I'm feeling anxious. I'm feeling, whatever way that's making me not feel 100%. But we don't necessarily talk about those things, and we really should normalize those conversations. I get it. It is hard to actually talk about your feelings, especially when those feelings make you very vulnerable. But in the workplace, and typically a place where you just kind of go there, you do the work, what we also see is that when you're affected by something that's bringing you down, it also is going to affect your work one way or another. And so one ways that companies can get in front of it is having those conversations. Maybe it's through bringing some people from the outside. Maybe it's by having some of those conversations internally. Maybe it's by, picking up on some of the, annual holidays and monthly, mental health awareness weeks and stuff like that to really start hitting that home. But I think that is definitely a start.
Thank you.
Yes, I would just agree with everything that Ryan said and Julie. And also just the more people share the stories, the less stigma we're gonna face. When people understand and have, by sharing stories, we learn how to empathize with others. And also, I wanted to mention the class that is available in many places called Mental Health First Aid. And there's a class, Mental Health First Aid for adults. There's a Mental Health First Aid for youth. But that is very helpful to help have people in the work more. If more and more people took classes like that one, and there are many out there like I mean, and NAMI, as Julie mentioned, NAMI Baltimore has them. You know, the more people know, the less stigma we're gonna face.
And if anybody would like to be connected to a mental health first aid class, thank you, Shannon, for bringing that up. Everyone on staff at NAMI Metro Baltimore goes through that mental health first aid training, and it is a phenomenal course that gets you not only aware of the challenges that we have in our community, but will also teach you how to start some of those conversations that you need to start with people around you.
I
We do
second that.
have,
I have a question if I could.
oh, sure, Marion, go ahead, please.
Thanks. First of all, vulnerability is such a courageous act, and both Shannon and Ryan, the vulnerability that you just gave to all of us is a gift. And I thank you very, very much. Courage doesn't come in any higher of a form. So very much appreciated your stories. And I also just took that mental health first aid class. It is available online. So if there isn't one available near you, you can do it online. And I was quite surprised at how effective the online training was. But my question is, Ryan, when you were speaking, you mentioned that, you didn't have access to mental health care. And I wondered if there were any statistics on the number of employers' healthcare plans that actually have a mental health component.
I don't have a number for that or the statistics for it. During that time, it was before they started changing the legislation and started treating mental health conditions as the same as physical conditions. So it was prior to that, because it was maybe about 5 years after that where they actually changed the plans, because at first, in order for me to get help, I would have had to spend about $1,200 in a deductible before they would actually start paying for it. And I just didn't have that type of money. And that was a major roadblock for me. Now, I would say that every employer that I've been to now at least has some type of program where it's either you can call in and speak to a therapist, or you can get help that's outside of your actual program. When I worked for the American Psychological Association, they had a specific program that was just for mental health. And it didn't take away from anything. There was no deductible. You saw your therapist, you talked about your issues and so on and so forth. And if you needed more help, either a psychiatrist or something else, you got sent to there. But I think it's now to a point where I see a lot more employers doing it. And I definitely hope that's the case, widespread, because I can't speak for widespread. I can only speak for the places I've been so far.
Thank you.
And I'm sorry, Marion, I don't have exact statistics on that, but I can look into it, and we'll send that information when I find it to Emma to share with you. We have another question in the chat. I want to ask this, and then I want to talk quickly about 988. And then if anyone wants to stay on, I want to be aware of everyone's time for a few minutes for more questions. I think we can do that too. Emma, maybe like 5 extra minutes. Is that okay?
Yeah.
Great. And so this question is, if there aren't resources in a rural location that can provide immediate in-person support, what do you recommend? And so I just want to share briefly about 988. I don't know if you have heard of 988. Has anyone on the call heard of it? It just rolled out in July. Okay, great, Shannon. That's wonderful. So Shannon knows, I'm sure Ryan knows. So the easiest way I think to think about this is like, this is your 911 for mental health. And so starting July 16th, this started, every person in every community nationwide, so you don't need to be in Maryland, you don't need to be in Baltimore, you can be anywhere in the US, can dial 988 to reach trained crisis counselors who can help in a mental health, substance use, or suicide crisis. So this is a crisis line. This is the new 3-digit dialing code connecting people to the existing National Suicide Prevention Lifeline. So the name has changed from that to the 988 Suicide and Crisis Lifeline. And you will get compassionate, accessible care and support available for anyone who is experiencing mental health related distress. That can be thoughts of suicide, it can be mental health or substance use crisis, it can be any kind of emotional distress. You can also use 988 if you're a person who is worried about a loved one who may need crisis support. And so the goal of this number 988 is to provide immediate crisis intervention and support. When you call this number, a trained crisis counselor will answer the phone, listen to the caller, understand how their problem is affecting them, provide support, and share resources as needed. And so they can help in a variety of crisis situations, and no caller is required to disclose any personal information. For most of the people who call into this line, calling, texting, or chatting 988 is the intervention, and we'll be able to resolve most of those calls. We're also working in our communities to be able to dispatch mobile crisis units to a person, so it would be a trained crisis team and not necessarily like a law enforcement officer who would show up, unless the law enforcement officer is part of a trained crisis team for mental health. And so we are building those out among the US as a whole. So they are existing in some places, but no matter where you are, you can dial 988 for that crisis intervention. So I just want to share that. If you remember nothing else from this conversation, I really do hope that you'll remember that 988 line, and I hope, future generations will know it the way that they know 911. We have another question in here, and I know most people had anxiety during the pandemic shutdowns. How did the pandemic impact your recoveries, Shannon and Ryan?
Do you want to take it, Ryan, or do you want me to?
I'll let you go. Go ahead.
Okay. During the pandemic, basically, I was still living in assisted living, and for the first couple of months, I couldn't even leave the 2 tiny rooms that I lived in, except, twice a day, the caregivers would knock on the door to do we were both double masked, temperature check. And once a week, I double mask, I would go down and pick up groceries outside, which I would have. But I was determined that I was going to move out of assisted living, because this was this was April of 2020, and everybody here knows what that April of 2020 was like. And, I was reading the news and, but that's when I started keeping the gratitude log, where basically I was like, I'm going to prove that I can stay positive, even in these difficult circumstances. And so I, every online interaction, every phone call that I had, even when I saw birds outside the window, I would make up funny stories about, because in assisted living, every elderly person was eating in their rooms. Therefore, there were mice. And so the mice would get into my food, and I would have vegetarian seaweed snacks. So these mice would sneak into them, but they would avoid the sticky traps that I had. So, I would write about how, I was training vegetarian mice to be Ringling Brothers circus, because they could jump over the sticky traps, because I would never catch them. But, this is kind of the foolish stuff, but I was just trying to stay positive. And it wasn't easy. I had a lot of support from my people from my church would call, and my minister, my friends, and online interactions with people.
I think for me, it didn't bother me as much, but my 18-year-old daughter, really, the pandemic really came down hard on her, not being able to see friends, not being able to go to school. When students returned, she still had to stay at home because we had a daughter that was immunocompromised, that had a tracheostomy and a G tube that was coming, out of her stomach, and we had to really take a lot of precautions. But because of that, my daughter she fell into really, really bad depression, and she ended up being hospitalized twice during that time. And last year, she was diagnosed with severe depression and anxiety. And so I think for a lot of kids and even a lot of workers, you remove them from what they're used to and you take away the things that's kind of like keeping them afloat. And it really hit her hard. And the same thing happened with my son. He really fell into depression bad as well, mainly because he couldn't be around his friends anymore. And the only time he was really able to see people was on the Zoom call, and not really being able to get out. It really did a number on them. So it was rough for them. And even with me working in the mental health field, it was a bit different. I'm not a teenager, so I don't see things the way that they do, but just trying to work with them, trying to coach them, trying to get them help. Yeah, I'm sure that a lot of people really struggled with the pandemic, either it be anxiety, either it be depression or something else. It was a struggle, it was hard. And for a lot of us, it still is.
The other thing I wanted, thank you, Ryan. I bet just to follow up on what Ryan was saying, I was thinking the other thing that I have found helpful is I started being a connection recovery support group facilitator during the pandemic in September of 2021. And I co-facilitated more than 70 virtual support groups during that time. And I live in Montgomery County, and in every support group, I share, look, the support groups where you're talking with other people who have mental health challenges can be very, very helpful. And also, you can log on. NAMI has virtual support groups every night of the week and somewhere in the nation. And because it's virtual, it doesn't matter where you are. And so, in Montgomery County, we have people logging on from, Washington State or Arizona or Texas, so.
Thank you all so much. I know we're at the end of our time here and past our time together, which I think just is so telling about how important this conversation is. So thank you, Shannon. Thank you, Ryan, for sharing your stories with us. Thank you, everyone on the call, for staying and for listening and for engaging with this conversation. We are really glad to be here with all of you. If there's anything that you see today or any of the conversations or presentations that we talked about today that you'd like to see in your own company, please feel free to reach out to NAMI Metropolitan Baltimore, or Emma can share my contact information with you. We would love to bring some more education out to your communities.
Absolutely. Julie, could you drop your email in the chat? Is that possible?
Sure.
Awesome. I think that would be great. And then folks can reach out if they have any further questions or ideas. I just really do want to thank Julie, Ryan, and Shannon from NAMI Metro Baltimore for your words and efforts. We're so moved by the insight that you brought today. My last note is that MCCEI is taking it to the big leagues and hosting a panel discussion on mental health as a part of our MCCEI symposium in October on the 27th. It's our Solving the Workforce Development Puzzle. This will be an all-day event featuring panelists, speakers, and activities around diversity and inclusion, construction innovation, investing in the future workforce, and of course, best practices for improving mental health in construction. So just like today, so please register for this exciting and innovative event. I'll drop that link in the chat as well as my contact information. Please keep up to date on our LinkedIn and all of our messaging systems and sign up for our newsletter. Of course, if you have any questions, please reach out to me and I will drop that in the chat as well. Thank you all so much for attending.
Thank you for having us.
Thank you for having us.
Thank you.
Thank you guys.
Thank you.